refers to Charlie Summers. Question 4 is, whether you're employed by a large company or independently employed, a constant question being asked is about health care coverage. One idea is for a single-payer healthcare system with the federal government to control coverage and cost. Yet another idea is letting the market drive costs and coverage. What is your stance on the healthcare question, and how would you suggest that Congress address healthcare?
Thank you. The healthcare question obviously is one that affects us all, and in particular affects small business in the state, because like I mentioned before, 98% of the businesses in the state are in fact small businesses. I think that it's very, very important that we stay away from the single-payer healthcare system. I think, why do you want the people who brought you the IRS to bring you your health care? I don't think that we need that. I think what we need to do is take steps in the immediate to deal with this issue. And by that, I'm a big proponent of small business health care plans. I think that small businesses should be able to band together nationwide to achieve group discounts on health insurance, just exactly like you do with Geico.com. Why can't, if you can get group discounts on health or car insurance, why can't you do the same thing in health insurance? That legislation is in Congress right now. It's been in the Congress for a long time. It's very, very close to being passed. I think it's important. That's an important first step. Beyond that, I plan to introduce legislation to make the cost of health care insurance 100% deductible for everyone. Everyone in the United States of America, not just big corporations, not just unions. Individuals need to be able to do that because small businesses want to do right by their employees, but it's very difficult. When I ran my own small business in Saco Bedford area, it was very difficult to afford the cost of health care insurance for yourself and your family, let alone your employees. I think small businesses want to do right by their employees, and I think if we take these small but very significant steps, it will be a step in the right direction. You hear a lot about people, we were at a debate the other night, and one of the candidates wants to wipe the entire slate clean and put in a single-payer healthcare system. Do we really need more bureaucracy? Do we really need more regulation? Do we really need to have more forms and things like that for our doctors or our nurse practitioners to fill out? I don't think so. We can take some easy steps forward. This is not a difficult way to move forward by making the cost of health insurance deductible by enacting association health plan legislation. I think it's very important. I told a story the other night. When I was a kid, I worked with Mother and Father's Hotel, and a lot of farmers with us would come to live at the hotel. And we used to have to wash the windows every spring. And there was one widow in particular, her name was Ada Norton. And Miss Norton, I was a little kid, and when you're a little kid and you're going in to wash the windows, you spray the middle of the window, and you go like that, and it's good, right? Not for Mrs. Norton. Mrs. Norton used to stand on the other side of the window, and she'd point to that corner, and then she'd point to that corner, and then she'd point to that corner, and then she'd point to that corner. And once we finally got all this done, she would say, look, if you take care of the corners, the middle will take care of itself, all right? And I think that's the same thing when you talk about the healthcare debate. If we want to get lost in all these big esoteric discussions about how we need to create this bureaucracy, how we need this regulation, and how if we do that, it's going to make it that much better, we're never going to be solving this issue. And 2 years from now, I'm going to be standing in front of you, we're going to be having the same discussion. I think it's time that we move, and I think it's time that we move now and enact the legislation that I've discussed. And those are the first two things I want to do as a member of Congress. Thank you.
There's a reason why Maine has the 48th worst economy in the country. A lot of it is due to the healthcare costs, especially that which has been perpetuated by Dirigo. Funny story, Mike Brennan, one of the Democrats Charlie alluded to, is proud of the healthcare environment he's built in Maine. And he said this in debate a couple of weeks ago, and I said, Mike, you don't live in the state of Maine, you live in the state of denial. It's one of the worst in the country. But anyway, I approach this from, once again, from a fair, free market perspective, which most of all, people in healthcare that should be making the decision are you and your doctor. Not a bureaucracy anywhere, whether it's an HMO, PPO, or the federal government, God forbid. It should be between you and your doctor. We know that's not happening right now. The reason why you can't buy insurance over the internet or from another vendor who happens to be in California is because we're still working under the Harry Truman notion, which was 2 different economies ago, right? I said I worked in the new economy, while the current healthcare environment was regulated in the 1950s. where everybody typically went to the same place of employment for their whole lives, and you bought your health care there. Today, 750,000 people declare their primary source of employment as eBay. What does that tell you? We've become a very transient world. I worked in the modern economy. I said, Dad, I had 10 jobs in 15 years, and he gets a stomachache. Guess what? That is common occurrence. We've been a transient society now. But our healthcare system still looks like 1950. That's where I looked at Ethan Strimley the other night. He said, I want to go back to the New Deal. I'm like, what are these people talking about? That's absolutely crazy. So the first order of business is no more 50 different insurance markets. Get rid of state-regulated insurance. So if you want to buy that health care policy in New Hampshire, that's a third of the price, you should be able to do that. That's Secondly, let me put my propeller hat on, because I used to be in technology and worked with computers, is that electronic healthcare records, digitization of healthcare records, sounds kind of cool, whiz bang, but we spend 78% of all expenditures for healthcare are to stop chronic disease, right? If we take all your data that's now on paper in your doctor's office and put it onto a computer, we can now do miracles with healthcare. Because now we can take your information, and if you get hurt and you're traveling in New Hampshire and you're from Maine, they hit it with a wireless right there, and they can start treating on the scene as opposed to guessing what your allergies may be. Digitization of healthcare, that actually increases wellness as well as reduced costs. The VA did this with a software program called Vista and cut out $60 billion a year. Finally, we have to implement medical malpractice reform. Medical malpractice reform is suggested by the AMA as one of the biggest cost components, to the point where doctors are shutting down in Pennsylvania because they're afraid to get sued. And they got to go buy the insurance, and the price of the insurance to get sued, to protect them from getting sued, is more than keeping the doors open. If you go to an OBGYN, you can sue that OBGYN for delivering your child all the way up to the point where that child is 18 years old. And you can sue them for whatever reason, forever how much you want to. That's wrong. So I'm a supply sider again, but I'm also talking about reducing costs, get rid of the regulation, let the free market rule, and let you make the decision with your healthcare provider. Time's up.